Pleased to introduce Dr. Professor P.P. Biswas, an iconic figure in Indian orthodontics and dentofacial orthopedics, currently serving as Professor, Head and PG Dean in the Department of Orthodontics and Dentofacial Orthopedics at Royal Dental College in Kerala.
A very good afternoon to all the delegates. I'd like to introduce myself as Dr. Biswas and I head the Department of Orthodontics in Royal Dental College, Kerala. Today, my topic for discussion is biomechanics of headgear therapy. I would just like to go into a few basics about biomechanics. First of all, I'm sure that all of you are, or at least most of you are third year students. And so you all would definitely have an idea about the basics of biomechanics. I would just like to define what is center of resistance and moment, and then we can continue. The center of resistance of a body is the point at which there is a resistance to movement. So this is the center of resistance of the maxilla. A moment is a tendency to rotate. That is, when you apply a force on a body, it tends to rotate. It can rotate in a clockwise direction. Then it is called an anti-clockwise moment, and it can also rotate in an anti-clockwise direction, and then it is called an anti-clockwise moment. So, but if you apply a force right at the center of resistance, then there will not be any moment. That is called zero moment. So, it is measured as the force into the perpendicular distance from the center of resistance to line of action of force. So you can see this distance. This is a point of force application. This is the center of resistance. So the perpendicular distance into the force gives you the moment. So we will come back to moments and center of resistance a little later in more detail. Now, what are the uses of headgear? The first use, of course, is growth modulation, where you can restrict or redirect the growth of either the maxilla or the mandible in growing children. We can also use it to control anchorage wherever the anchorage requirement is very high. We can reinforce the anchorage either in the sagittal direction, transverse direction, or in the vertical direction using headgears. To control the side effects of fixed appliances also, we can use headgears. For example, if you're using a utility arch to intrude the upper anteriors, then definitely there is a reciprocative extrusion of the posterior teeth. So that can be controlled using a headgear. So this is vertical anchorage. Number 4 is to control the occlusal plane cant. Like in debite cases where you want extrusion of posteriors and intrusion of anteriors, headgears are used, or in open bite cases where you want intrusion of posteriors and extrusion of anteriors. You can use it along with a fixed appliance, or you can use it as a splint. And number 5 for tooth movement, mainly in molar distalization. So these are the various uses of the headgear. Of course, now with the advent of temporary anchorage devices, the use of headgears have been reduced, but it cannot be replaced in growth modulation, especially. Now, coming to the types of headgears, according to the pull, you have the high pull, which takes anchorage from the parietal and the occipital bone. You have the cervical pull, where the anchorage is taken from the cervical bones and the occiput. And then you have the combination pull, where the high pull and the cervical pull is combined. The interlandi headgear is used mainly for discalization purposes. Again, it is a combination of a cervical pull and a high pull headgear. Coming to the parts of the headgear assembly, you have the intraoral appliance and the extraoral appliance. The intraoral appliance could be a fixed appliance where you have a headgear tube into which the outer bow of the headgear inserts, or you can even have headgears fixed on to functional appliances. This is a Frankel appliance with a headgear tube on the vestibular shield. This is a twin block appliance with a headgear tube attached to the upper bite block. You can also have a headgear attached to a removable maxillary splint, as in this case, or you can even have the outer bow completely covered with acrylic in headgear splints. Coming to the extraoral appliance, it is the inner bow. This is the inner bow. And then the inner bow could be out of 014 or 051 in diameter. And this is the outer bow. The outer bow is 072 in diameter. Now, the outer bow is available in three sizes. It could be short, outer bow short here. It could be medium, or it could be long. It's available in three sizes. Now, on the inner bow, you always need to give a stopper so that the inner bow does not slip through the tube and injure the soft tissues. So these stops usually could be an omega loop, or you could even have a crimpable stopper, or you can have bayonet bends. So these will prevent the inner bow from slipping through the through the headgear tube and injuring the soft tissues. So it is always compulsory that you give a stopper near the just mesial to the headgear tube. Now you also have the J hook type of headgear where the hook is attached onto the arch wire, but it is not very popular these days. It is mainly used for intrusion of anteriors. So that is about the inner bow and the outer bow of the headgear. Now coming to headgear straps. Now you have different types of headgear straps. Along with it, you have force modules. So this is a very typical force module. It is a spring-loaded device, and you can adjust your forces according to these holes over here. So the force modules come as heavy and light. Now, coming to the biomechanics proper, first of all, I would like to talk about the center of resistance of the maxilla. Different authors talk about different center of resistance of the maxilla. According to Tosha, the posterior superior aspect of the zygomatico-maxillary suture is the center of resistance of the skeletal maxilla. According to Nanda, the center of resistance of the maxilla is 5 to 10 millimeters from the orbital on the zygomatic bone. According to Braun, the center of resistance is at a point between the orbit and the molars. According to Prof, the center of resistance of the maxilla is between the two premolar roots, just above the two premolar roots. According to Tane, the posterior superior part of the pterygomaxillary suture fissure is in the median sagittal plane is the center of resistance of the maxilla. According to Marcotte, the center of resistance is 6 to 8 millimeters above the apices of the upper molars, 6 to 8 millimeters. So, for all practical purposes, I will take Profit's center of resistance, that is a point just above the apices of the two premolars, into account. Now, to estimate how much of horizontal and how much of vertical forces are delivered with the headgear, that is a particular formula using the law of parallelogram of forces and the trigonometric formula. Now, if you look at this figure, the horizontal component of force, this is the headgear force that you are applying, and it has a horizontal force, sorry, and it has a vertical force. Now you need to know how much of vertical force is there and how much of horizontal force is there. The horizontal component of force is given by F cos theta, and vertical component of force is given by F sin theta, where theta is the angle formed between line of force and occlusal plane. So the pink is the line of force, and this is the occlusal plane, and this is theta. So you have to use the formula F cos theta for horizontal component, and you have to use the formula F sin theta for the vertical component. We'll come to that. Now, let us say you are giving a cervical pull headgear, and this is the occlusal plane. So the force vector and the occlusal plane forms an angle and which is 10 degrees. And you are giving 300 grams of force with your cervical pull headgear. So to know the horizontal force vector, the formula is force, F is force, so it is 300 cos theta, 10 degrees. So it will be 295 grams of force is being developed in the horizontal direction, while in the vertical direction, force is 300. You have to, the formula is F sine theta. So it is 300 sine and 10 degrees is theta. So you will have 52 grams of force generated in the vertical direction. So that is how you calculate the amount of force that is generated by a headgear, both in the vertical and in the horizontal planes separately. This is another example where you are having, this is the direction of force, this is a cervical pull headgear, and this is the occlusal plane. So you have an angle of 20 degrees. So 300 is the force given by the headgear. So 300 cos 20 degrees is 281 degrees. That is the horizontal force generated. And 300 sine 20 degrees is 102 grams. So that is the vertical force generated. So how you make these is you need to ask the patient to put on the headgear, take a radiograph, and then you need to trace the line of force and the occlusal plane. The rest you can calculate using your protractor. Now coming to a high pull headgear. Now let us talk about the forces passing above the center of resistance of the maxilla. So according to Profit, this is the center of resistance of the maxilla, and your force is passing above the center of resistance of the maxilla. How do you get the forces to travel above the center of resistance of the maxilla? It is by bending the outer bow outward and upward. So now what happens to the maxilla when you generate a force? There is a anti-clockwise movement because the force is generated above the center of resistance of the maxilla. So the maxilla rotates in an anti-clockwise direction. This is indicated in cases where you have a gummy smile, where you have a deep bite, a decreased lower anterior facial height, and horizontal growth pattern cases. Stopwatch. When you are passing the forces through the center of resistance, let us see what happens. So you angulate the outer bow through the center of resistance, and then what happens? There is no movement. So the maxilla translates as it is. This is indicated in situations where you don't want extrusion or intrusion of posterior teeth. In situations where you have a vertical maxillary excess, increased lower anterior facial height, vertical growth pattern, and a gummy smile, this is indicated. You don't have to really mug up all these. If you know the movement that occurs with the maxilla, then you will know where it is indicated. Now let us take a situation where the forces are passing below the center of resistance of the maxilla. So the outer bow is bent downwards. What happens to the maxilla? There is a clockwise movement with intrusion of the posterior teeth and extrusion of the anterior teeth. So this is indicated in skeletal open bite, vertical growth patterns, decreased incisor visibility, increased lower anterior facial height. Now, I spoke about how we would be applying forces above and below the center of resistance. Now, let us see a situation where you have the outer bow above the occlusal plane. So, that's the center of resistance of the maxilla. And now you're having your outer bow placed above the occlusal plane. So, all these pictures are relating to placing the outer bow above, at, and below the occlusal plane. So that means to say, in all the situations, the force vector is traveling below the center of resistance of the maxilla. That means always it's going to be a clockwise movement. But is there any difference by having the outer bow above the occlusal plane, at the occlusal plane, and below the occlusal plane is the question. So what is the moment? It is a clockwise moment, and you can see it is a small moment. Okay. Now let us come to the next picture, and there you can see that I've placed the outer bow at the occlusal plane. And what happens? Here you can see the arrow is much larger, and the movement of the maxilla is also much larger. That means to say the moment generated is much higher. So there is a larger moment. Now finally we are placing the outer bow below the occlusal plane, and now you can see that the arrow is still larger and the moment is still more. That is because of the distance from the center of resistance of the maxilla to the point of force application. So here it is larger, here it is short, still lesser, and when you have it here, it is very close to the center of resistance of the maxilla. So the moment generated keeps increasing. So supposing you want a large amount of moment, you want your headgear to be very effective, you need to travel more far away from the center of resistance. So that is force into distance. That's why the moment keeps increasing. Now, let us look at change in moment with alteration in the outer bow. So that's the center of resistance, and the outer bow now is almost in line with the center of resistance. So it is a short outer bow. And what happens here? There is a clockwise movement. Okay, because the forces are traveling below the center of resistance. Now, if you look at this picture, you can see that I have reduced the length of the outer bow. That means the distance to the center of resistance is still increasing. So what do you expect? You will have a larger moment. So you have a larger arrow there. Now here, when the forces are traveling below the occlusal plane, that was above the occlusal plane, here below the occlusal plane, you have a larger outer bow. This is the distance to the center of resistance. You will see that there is again a clockwise movement, which is even more larger than this because the distance has increased again. Now I put a short outer bow below the occlusal plane, and here what happens, you're going to have a still larger movement. So in the first two cases, you have a short, long outer bow, a short outer bow, both are above the occlusal plane. So as the distance increases from the center of resistance, the moment keeps getting larger. Here again, I'm having both the outer bow here and here is below the occlusal plane. Here it is long, here it is short. It is increasing the distance from the center of resistance, so you have a larger moment. So you can, by altering the direction of the outer bow, by even altering the length of the outer bow, you can have different moments. You can have larger moments. Now we'll talk about the biomechanics of cervical pull headgear. Now, if the forces are passing through the center of resistance with a cervical pull headgear, you can see that there will be a clockwise movement. And this is indicated in cases where you have a gummy smile and skeletal deep bite. It is a rare occasion, but you do see in class 2 D2 cases where you have a gummy smile and a skeletal deep bite. So what does this do? It will bring about extrusion of the posteriors and intrusion of the anteriors. Now let us pass the forces above the occlusal plane in a cervical pull headgear. I'm sorry, through the center of resistance. So whenever you pass the force through the center of resistance, then there will be a bodily type of movement, and the entire maxilla with the teeth will move. And so this is indicated in cases where you have a prognatic maxilla, decreased lower anterior facial height, skeletal divide, and a horizontal growth pattern. Now, forces passing below the center of resistance of maxilla and above the occlusal plane. Okay, so it is the forces below the center of resistance of the maxilla and above the occlusal plane. What do you expect? A clockwise rotation of the maxilla with extrusion of posteriors and intrusion of anteriors. And this is again indicated in gummy smile, debite cases, decreased lower anterior facial height cases, and horizontal growth pattern. Now, so we were talking about placing the outer bow above the center of resistance, through the center of resistance, and below the center of resistance. Now, the outer bow is placed above, at, and below the occlusal plane, not the center of resistance. So in all the situations, the bow is below the center of resistance of the maxilla. Okay, so always you're going to get a clockwise movement. But what is the difference? The difference is in the moment produced. So that is the center of resistance. Now you are passing it above the occlusal plane. Okay, so it is still below the center of resistance. So you will get a clockwise movement. Now, in this situation, I'm going to take the outer bow at the occlusal plane. That means the distance is getting larger, the moment is larger. If I place it below the occlusal plane again, the moment will get still more larger. So you get the same type of movement of the maxilla, but the moment generated is much more. So if you want to get a more effective treatment, you need to increase the moment, like in these situations. Now, changes in moment with the alteration in the level of the outer bow. Okay. Now, let us see the first situation, the center of resistance. Now, the length is almost at the level of the center of resistance of the maxilla, the length of the outer bow. But it is in all these situations, let us see. In this situation, it is below the center of resistance. So you will get it is above, I'm sorry, it is above the center of resistance. So you will get an anti-clockwise movement. with intrusion of anteriors and extrusion of posteriors. Here, the length of the bow is made shorter, so it stands below and mesial to the center of resistance. So what is it that you're going to get? You're going to get an anti-clockwise movement. So just by altering the length of the outer bow, by applying the force above the center of resistance and below the center of resistance, I can change the moment as anti-clockwise and clockwise movements. If you look at the third situation, I've taken the outer bow below the occlusal plane. It is long here. You're getting a clockwise moment. In the fourth situation, I'm placing a short outer bow, and so I'm getting a larger moment because the distance to the center of resistance is still more. So in this situation, I've altered the length of the outer bow. In this situation, I've altered the length of the bow by keeping it below the occlusal plane. In these two situations, the moments are differing. Coming to interlandi headgear. So interlandi headgear, you can vary your forces very well because it's a combination of a high pull and a cervical pull headgear. So according to usually we use headgear elastics onto the outer bow. And so depending on how you change or which of these holes you use for your elastics, they are open at the posterior, these holes. You can insert your elastic. So now if I want a dislocation of the molar, then I can target the center of resistance of the molar. So I will alter the shape of the outer bow so that it passes through the center of resistance. So this will give me a bodily type of retraction of the molar, dislocation of the molar. So it is mainly indicated in dislocation of the molar. Now this is how you draw a triangle. As I told you earlier, this is your line of force, this is your occlusal plane, and this is your theta angle. So this is how you will be able to decipher the vertical amount of forces and the horizontal amount of forces. Now, headgears can be used for tooth movement also, mainly for dislocation. The force value is around 150 grams per side, and the period is about 12 to 14 hours. Now, as the molars dislice, you need to give a little more of expansion also in the inner bow so that the molars will not roll in lingually. Headgears, other tooth movements are with headgears are they can be used for molar crossbites so that by expanding the inner bow by about 3 to 5 millimeters. They can be used for space maintenance or stabilization and also for retraction of anteriors by using J hooks by giving at least 125 to 150 grams of force. The force magnitude depends on what type of use you are putting the headgear to. In cases of growth modulation, you can use about 250 to 500 grams of force per side. In just to control molar anchorage, about 100 to 150 grams would be sufficient. But in molar dislocation, more than 200 grams would be required. Now, the current recommendation of force for dislocation by Profit is 350 to 450 grams of force. Now, extremely heavy forces can cause damage to teeth and supporting structures. So, you should be a little aware about the force values. Force values used in the range of 200 grams per side in the mixed dentition would be fine. 500 grams in the permanent dentition also is fine. This is by Marcotte. Coming to duration of wear of headgears, most of the authors claim that intermittent forces produce skeletal change while continuous forces produce more of dental movement. Some authors suggest that in pre-adolescent children, 10 to 12 hours per day is effective in controlling growth. Other authors suggest that 12 to 14 hours per day is sufficient to bring about even skeletal effects. But Marcotte is one of the authors who suggests 26 hours per day. So 26 hours means 2 hours more than a day. That is just to emphasize that how long a patient should be strictly wearing the headgear. For anchorage reinforcement, 18 to 20 hours per day is the recommendation by Marco. So you need not be confused. There are a lot of authors who do suggest headgear wear for just 12 to 14 hours. And at the same time, there are a lot of authors who suggest 24 hours of wear of the headgear. I, with my experience, would suggest 24 hours of wear of headgear. Now, yeah, again, Raymond Siatkowski is also another author who suggests 12 to 14 hours of wear of the headgear as sufficient. Now, we have finished with high pull headgear, cervical pull headgear, coming to protraction headgear. So protraction headgear is a dual forced appliance where it has an anterior force on the maxilla and a posterior restrictive force on the mandible. It is more effective in bringing about maxillary growth than uh, controlling the mandibular prognathism. According to Prof, the indicated age is 8 years, where you need to start with treatment and you should finish your treatment by about 10 to 11 years. This is because this is the period of time the maxilla grows actively. And Petit is one author who recommends 24 hours of wear with 800 grams per side. So that is the real recommendation of a protraction headgear. Now, coming to the biomechanics of headgear, you can see that this is the center of resistance of the maxilla. The entire dentition is below, and the appliance usually for a protraction headgear is usually anchored onto the maxillary arch. So the protraction force on the maxilla is standing below the center of resistance of the maxilla. So what happens over here? There is an anti-clockwise movement of the maxilla. For that reason, the posteriors extrude, the anteriors intrude. There is a tendency to elongate the face, and there is a tendency for an open bite. So that is the reason why when you are giving a protraction headgear, you have to place the elastics in a forward and downward direction, almost at 30 degrees to the occlusal plane. Coming to chin cap therapy, when you're using a chin cap, the force should travel, if you want to restrict the mandibular growth, the force should travel through the condylar head. You have headgears also where the force vectors pass through the coronoid process and it is anterior to the coronoid. In these situations, there is a good control of the vertical growth pattern also. So when you have a open bite tendency, then you need to pass the forces either anterior to the condyle, that is through the coronoid, or anterior to the uh, through the anterior to the coronoid if you have an open bite tendency. So that will give you an anti-clockwise movement. When you pass the forces through the condyle, there is a tendency for the face to elongate. It produces both inferior and posterior displacements of the mandible, and it is the line of treatment for class 3 cases. So I would like to conclude by saying that headgears have lost its popularity because of a lot of many plates and many implants coming into orthodontics. But you need to understand that these cannot be used in mixed dentition cases, and what the headgears do cannot be replaced by these gadgets. I thank you for your patient listening. I would like to thank the organizers for giving me this wonderful opportunity to speak. Thank you.